I started the care plan 10 years ago to do exactly this. Prior to starting my company, I had worked in healthcare and aging services for about 15, 20 years as a caregiver, administrator, all kinds of things. But I didn't see queer, trans, and gay elders, and the ones that I did basically were of the silent generation. This is my friend, I'm grieving my roommate, but never being able to say, I'm gay, this is how I've lived my life, and this is what I want in the fourth quarter. So for me, inclusive care is about bringing folks' perspectives from the margins to the center, which is what we try to do. We come from a queer-centered perspective that's really inclusive of things like retirement families, for example, or having your ex be your power of attorney and who ends up taking care of you. Things that are kind of distinctly queer are the starting place. And for me, I think inclusive care is doing that well, not trying to be everything for everybody, but bringing folks from the center, from the edges to the center, and providing excellent quality care in the best way that you can.
Awesome. Hello, everybody. My name is Pidgeon, like the bird. Pidgeon Pagonis. My last name, actually, I found out means peacock, which I did not know when I named myself Pidgeon back in college when I was dating you, Ashley Vento. My first girlfriend is here, everybody. Give it up for Ashley Vento from Boston. Love you. My name is Pidgeon. I'm a Pisces sun, Aquarius rising, and a Taurus moon. Any Pisces in here? Only one? Oh my God. Wait, for real, there's only one other Pisces in here? 2, 3? Okay, cute. I have ADHD. Anyone else have ADHD? Yes. I was getting lunch with my girlfriend, my first girlfriend, and they were like telling me they got diagnosed recently with ADHD adult. And I was like, I got diagnosed with that too. And they're like, I knew that in 2004. And I was like, you knew I was gay before I was gay. You knew I had ADHD before I got, what's it called? Diagnosed. They're psychic. I have ADHD. Like, anyone else have ADHD? We already raised our hands, right? Okay, yes. Cool. I've been playing softball since I was 6. Anyone else play softball?
That's not me, but I did have a question, Pidgeon.
What's your question?
What does inclusive healthcare look like for you, my friend?
Oh, I'm going to get there. Don't worry. We got a lot of time. So there's a point to why I'm telling you all these things. It's going to all tie back. Trust me. I'm not just doing this randomly. I play softball since I was 6. We just won the championship. Anyone like softball? Good. You're a lesbian. Got it. I love dancing to house music because I'm from Chicago. Anyone else like house music? Yes. Love house music. And inclusive care to me means time, it means kindness, and it means curiosity. And the big one out of those 3 is kindness. When I have a doctor or a physician or a provider who is just kind, I cry every single time. I don't know why, but I cry. So kindness is honestly the biggest thing when it comes to inclusive care for me. It's remembering that healing isn't medical. It's emotional, it's spiritual, and it's communal. I believe everyone has the right not just to survive, but thrive. You're probably wondering, why the hell is someone with a bird name, with ADHD, who's a Pisces sun, invited here to speak? I was born intersex, neither male nor female. And that made my body a target for a medical system that's obsessed with control. Anyone ever heard of intersex before? That's right, because you guys are smart. I was cut and I was lied to as a child. And I'm told that it was to fix me, quote unquote. So inclusive care means care that doesn't fix us, intersex people, or fix anyone. It's care that listens and learns and lets us lead. And that's just a little bit. That's just the tip of the iceberg. We were just in this room with icebergs in the back here. Yeah, you gotta check it out. That's just the tip of the iceberg for what inclusive.
That's fine. fine. It will survive.
what inclusive care means for me.
Amazing. So, with all of that amazing, you were talking about kindness. So, when you're asking about like kindness in general, like, here's how are we going to phrase this? For you, like, what does that actually look like in a healthcare setting? Like, is it generally like asking for certain things? Is it just a certain house manner? Is it something that you can find on a website? Like, what does that, how do you actually find that?
I think that's a great question because kindness also can mean different things to different people. So I think I'll share a few examples. And these are kind of intense, right? I'm a healthcare advocate. I have the honor of being with people in some of the most vulnerable moments of their life, all the way up and through end of life. But I'm struck by consistently how on guard we have to be as consumers of healthcare and how rare it is to find that kindness, right? So oftentimes kindness looks like time and listening. And when I'm talking with medical professionals or training them, I'm always training in terms of our community about the trauma we've experienced. Many of us in this room and many people beyond this room have experienced medical trauma, right? I did when I was 15. And it impacted how safe I could feel in a medical institution. So kindness, I think, in queer community and trans community and LGBTQ community generally, we're really good at networking. We're really good at asking for what we need and saying, hey, do you know a doctor that's fat friendly, good with Black folks, great on reproductive health? Like, who do you know? It's very informal, the ways we often find that kindness. And then those doctors get everybody's business because we're just so relieved to be able to just have a reasonable conversation about our healthcare, right? So when I train, I talk about things like motivational interviewing, reflective listening, getting rid of these 7 to 15 minute appointments and just expanding because, when I started my business, that fear of will I be treated with kindness was present in everybody that called me. Everybody that called thought they were going to be rushed. They thought they were going to get a robot on the phone. And one of the first confirmations that I was on the right track was there was this person who, had a host of health issues, and we just talked for 2 hours. That was the intake conversation, was 2 hours of them explaining to me what they had been through and what they were hoping for and what they wanted for their gender affirming surgery. And I was like, oh, these are different conversations. This is a deeper level of being human with each other in healthcare. And this is where I want to be. And this is the kind of people I want to work with, is people that value us. And so kindness, I think there's a lot of ways, but usually the tried and true ask somebody is safer than what you see on a website or if they've had a training. Sometimes, for a while there, we were the hot new thing. And so everybody was getting trained on LGBTQ care, but there's still a difference. There's a huge difference when you're coming from community and you work with community long-term and you know what we really need, than if you, have put a rainbow on your website.
So for someone like re-entering a community or someone who's moved to a new place, how do you find that kind of community, or what's the easiest way that you've seen? I know that you've worked for national groups, consulting for national groups. How do those people new folks find community quickly?
Great question. I'll just answer quick and then I'll pass to you because building community is a labor of love and takes time, and that's a separate thing from getting your needs met in the moment. So if you move someplace or you need a specialist, couple of resources. Always check the Gay and Lesbian Medical Association. They're online and they do keep their information updated. So at least you can find a doctor that either identifies as LGBTQ+ or has extensive experience in specialization. So the Gay and Lesbian Medical Association, great place to go. Also, your local LGBTQ centers, even if it is not in your hometown or your area, still call because they are usually working regionally, right? The one in Chicago is fielding calls from Indiana, Wisconsin, and Iowa. So they tend to have some resources at whatever your local space is. The other group that I think gets overlooked are local LGBT chambers of commerce. That might not be where you find your doctor, but it might be where you tap into the network first, right? Find a therapist, find a psychiatrist, find your accountant, and then you're in the network. So getting tapped in somewhere, I would suggest to start.
Yeah, do you have anything to add to that, Pidgeon, or any way that you've helped find community in other places quickly?
I just gotta say I'm blessed because I live in a big blue city, Chicago, just like Boston is kind of a big blue city. I know they're not perfect, right? But when I hear this question, I think about these answers, I just think about people in rural areas, and I just think about what does it mean for them actually? How do they do that? But in Chicago, it's easy. I'm an outgoing person, I'm an extrovert. We do it through community. I call up my friend Shira, our friend Shira, with every question, right? I have those people in my community. I think there's even you said the websites and stuff. So I have really nothing to add to that. Yeah, I just have a question or I just want to know, I want to figure out resources for people that don't live in a blue city. But it's getting crazy, right? Like in Chicago, like for instance, what did Trump say? You can't do trans healthcare in a lot anymore, right? Or you lose your federal funding. So even in these blue cities, it's going to be harder. But at the end of the day, we have each other, and we've always had each other. And so it is through community, and certain things you can do is like our friend Shira again. I have a friend that will offer to go to the doctor with me. And so I think that's something we could do for each other when, say, someone's new to a city or whatever, like, hey, would it be helpful if I went with you? Because it's scary. It's really scary. And on the kindness tip, and not just having a rainbow flag on your website, I went to this place in Chicago, shall not be named. I'll name it, Rush Hospital. They have a queer clinic, and they're all about the queer stuff and the trans stuff and do. And I went to go see this. Anyone a surgeon here? Anyone a doctor here? Anyone? Who's my audience? Anyone in the medical world? Okay, cool. I went to see a trans surgeon. They're part of this clinic. The first thing they asked me when I got in the room, they said, first of all, we gotta take pictures of you. And I said, what? And then they said, what are you here for, top or bottom? I said, huh? I was 38 or 39 at this point. I know how to navigate these systems. And I was still caught off guard in Chicago, in the trans clinic that's supposed to be all LGBTQ friendly. The first thing they said is, you here for top or bottom? Also, we gotta take pictures. I said, can you ask my name? Can we go on a first date before you take pictures of my vagina or my top, my top or my bottom or whatever? So I think this guy comes in eventually, the surgeon. He said, he tried to do an exam on me, a physical exam. He tried to push it through real quick. My body was not having it. He said, oh, well, I'm sorry, we gotta put you under anesthesia with some other doctor, and that's when we could do the exam. Can't do it like this. I'm like thinking, oh, he must be right, because he's a doctor. He's an expert. He goes, you know what though? Because if you're gonna get I went in looking maybe to get possible surgery, to get my vagina open bigger. Long story. I have a book. And anyways, I'm thinking, okay, maybe that's what I might have to do. He goes, but you know what? Even if I give you that surgery, I'm gonna make you go see this pelvic floor physical therapist before and after. And you know what? She's here, so let me just introduce you. She comes in, totally different vibe. Kindness, talks to me like a human being. We set up an appointment. I go to pelvic floor physical therapy for the first time. I'm 39 years old. I've been intersex and in the system since I was literally 6 months old. Not a single point of contact has anyone, and I go to therapy since I was 20. No one has ever mentioned the words pelvic floor physical therapy, which is a non-invasive, non-surgical way to probably that could help me with my body. I'm with this person. Would you know, after 2 years, it did take 2 years, but I didn't need surgery. I needed someone to be kind, to talk to me like a human being, and to make me feel safe, which took so much time, like you said, and so much patience.
And also that second opinion that helped as well. That second opinion, the ability
second opinion.
that you had that surgeon who gave you almost that second opinion in that way, and being able to actually give you that way out.
And what's that saying? If you only got a hammer, everything looks like a nail? That's what surgeons do, right? A lot of times. They see through the lens of, what did I say earlier? You're broken, we need to fix you. And I'm gonna do that with a scalpel. But honestly, I just needed some kindness, and I needed someone to take care of me in a gentle way. And I think that's the struggle, is how do we connect people with that kind of care? I got lucky, right? There's this thing at Rush called Affirm, and it's supposedly for LGBTQ stuff. So they got psychiatrists, they've got doctors, they've got everything that's supposedly like safe for trans and queer people like myself. But what about people that don't have that? So I guess I would say, look at your hospital networks in your city and see if they have something like Affirm, which is a network of doctors that are all supposedly like LGBTQ safe or whatever. But yeah.
Can I offer something
Please,
else around
I
that?
want you to, yes.
And thank you. Can we just give some love for like the real vulnerability and honesty that's being shared up here? Thank you, friend.
Thank you.
There's 3 places that I've found across the lifespan to access that kindness more consistently. One is geriatricians. If you are of the age where you can get a geriatrician, do it as soon as possible. Their visits, on average, are twice as long as anybody else's. And they're experts in what happens to the aging body, right? And how medications change and hormones change. So if you really want excellent health care, I can strongly recommend getting a geriatrician as soon as you're able to. Now, what about if you're younger and you have some kind of chronic health condition? Palliative care is the second discipline that I've really seen a different pace, a different intention, seeing a person as a whole person, and choices present. Palliative care is one of the only places where they really ask you, like, do you want to do all these tests? Do you want to approach this? What's your approach to your health care? And the third place I consistently experience kindness is in integrative medicine, right? Those doctors also are accustomed to much longer intakes and conversations, and tend to be really a lot more accessible and intentional about figuring things out. Because I think that's a challenge for our community, is sometimes we're dealing with conditions that don't get a lot of credence, like fibromyalgia or chronic stress, or things that wear away and eat us up, but nobody's like digging to figure out the cause. And integrative medicine, I think, does a really good job of that. So I just wanted to offer those if you're like, I don't know people in my town, I got nobody, but where can I get a softer landing place to enter healthcare? I wanted to offer those. Thank you.
Does integrated health, is that like something that like is written on like someone's website, or is it like, I do this and I do that and I do that and I do that?
No, integrative health typically tries to differentiate themselves. So they're like, because they do a lot of training around different modalities, you know, and I kind of tend more to holistic medicine. I've seen too much. So I tend more to holistic and alternative therapies. And so, you know, if I'm looking for an integrative medicine doctor, that's what I search. And then you'll find those folks. But they tend to specialize because they did a lot of work to round out the traditional Western education.
Yeah. Do you have anything else to add, Pidgeon?
I just want to say thank you, because I'm like, I'm taking notes. I got to go see a geriatrician. I got to see a palliative care, you said? And the third one was?
Integrative.
Oh, and I just went to one for the first time this week. Functional medicine, something like that. And it did say functional and integrative. It listed the doctors.
Yeah.
It's called Whole Health Chicago. And then it said, like, this is the type of doctors they are. And they listed it on their website, if they were integrative, if they were functional, et cetera, et cetera.
Yeah.
And true, just took time.
Good for you.
Felt trusted, felt like I trusted. Yeah, it was great.
No, that's all awesome.
It was $200 because they didn't take my insurance, but it was great. It was great.
Speaking of, you've both worked on national scales, working with all different kinds of organizations in developing and creating that kind of softer place to land for a lot of folks. Especially in the healthcare system, what is kind of one of those hardest falls that you've seen?
Hardest falls?
Like, yeah, where's a place that people where you consistently see people have that big gap? Yeah. I know for me, it was just going and knowing that I could bring a friend.
Right?
I didn't know that that was a thing.
Yeah.
Like, I didn't know that until this year, and I'm in my 20s. But like, where is that biggest gap that you may have consistently seen in healthcare system?
I'll start. Okay, I'm sorry, but I do everything through an intersex lens because there's not many intersex people out there that are doing talks. So I'm gonna give the intersex answer to this.
And that's why we brought you here.
Thank you. The biggest gap for intersex people is everything. There is nothing for intersex people specifically. The whole thing is a gap. The whole thing is a big hard fall. Have you ever heard of an intersex, let me enunciate. Have you ever heard of an intersex clinic for adults?
No. I'm going to assume that the silence is a no.
Exactly. No, it doesn't exist, right? There's so many clinics that are so ready to do surgeries that we didn't ask for when we were babies, when we cannot talk, when we cannot stand up for ourselves and advocate for ourselves. But there isn't a single specialist, let alone clinic, that is for intersex adults who are able to advocate for themselves, who have needs and who want to talk about their body. It just nothing exists for us. So the biggest barriers or the biggest falls are invisibility, ignorance, and isolation. Most providers have never learned anything about intersex people, and if they have, it's not enough. It's insignificant. They don't know how to talk to us, let alone care for us. And the few who do often keep us separated instead of helping us find community. There's no reason I should be going to a clinic or a hospital as an intersex young person and never told that there's other intersex people there that I can connect with. They kept us separated because, they wanted to. If you keep us separated, then we can't challenge their power. We also need more than just talk therapy. Because trauma lives in our bodies, we need somatic healing. So that's another huge gap or fall, is often we're told, just go to therapy. And I was just talking with Ash about this. Like, I don't think talk therapy, it can only get certain people so far, especially when the trauma lives in our bodies.
Yeah, definitely.
So we need to expand our ideas around what therapy is. And we need to be able to start funding or having community programs that put money into giving people the ability to go seek out all these forms of healing that exist that are not covered by insurance. One that comes to mind is acupuncture, which sometimes is, but there's so many other modalities of healing in the holistic world and in Chinese medicine and in so many other forms of healing that are not covered by insurance. But we need to start pushing money into services that allow trans and queer and LGBTQ and intersex people to be able to access those types of, those forms of healing. And another gap I would say is often I've been told, oh, but the doctors, they meant well. They just did what they were trained to do, and they didn't mean to hurt you. And I think that's a huge place where we often fall, and I think our trust gets shut down, because every time I hear that from a well-meaning physician or provider, I shut down and don't trust them anymore. So that's another big pitfall, is like, just please don't say that to your intersex people. Like, don't tell them like, oh, but they meant well. Because it just makes you not trust the person you're talking to. So that's another big pitfall.
Yeah.
Can I just add, that is so pervasive in the aging space. Like, the number of times I've approached administrators about LGBTQ community, and they're just like, well, we treat everybody the same. I'm like, well, if you don't understand that, like, at age 50, 41% of our lesbian, gay, and bisexual folks are dealing with a chronic illness or disability, and 65% of our trans siblings have a disability at age 50, and your services don't start till 62 or 65, you're completely missing the boat. You completely have no idea how to care for us, let alone know the disease progressions that are more likely, right? That breast cancer is more pervasive in lesbian and bisexual women's community, and that HIV is still here, present, causing unique challenges for our aging seniors, right? There's the huge gaps that I could talk about on that side, and thank you for addressing so many of those. But I think I really like to come from a place of power, and we give away our own power by not understanding we are consumers of healthcare. That's where it starts, whether it is, can I bring somebody with me? Of course I can bring somebody with me. You're getting paid at least $150 an hour for this 15-minute visit. I could bring my whole family in if I wanted to, right? We accept treatment in healthcare that we wouldn't accept from McDonald's in terms of wait times and respect and tell me what's in my food, right? Tell me what's in this medicine. Tell me what to expect. We don't treat ourselves as sophisticated consumers of healthcare, but we really are. And so that's where I would start. That's the gap you can and have the power to close, is how do we take our power? How do we assert ourselves? And making sure that you're walking in there as a consumer, right? Not with this like, the doctor knows everything, but I am the expert of actually my body and my whole lifetime of experience. So let me educate you about me and what I'm here for today. And let me ask every question I have, and let me not get nervous if you seem like I'm wasting your time. Because again, that person is getting paid probably better than most of us ever will for that 15 minutes. So we should act like consumers. I think that's where it starts.
That is amazing.
I just want to say that was amazing.
And actually, on that, we did have a question of about, where was it? There it is. As the federal government seeks to access lists of trans people and medical records, do you have any tips or questions that trans folks can ask their medical providers about security, their information, or is there something about that kind of like merging that gap? What can folks do in order to make themselves feel as secure? Or do you have any kind of phrases that people can kind of have right off the bat?
Oh man, it really depends on your unique situation because,
Definitely.
like in Chicago, where both of us are based, you know, immigration is the bigger issue right now, right? So like if I have a client who is trans and undocumented, we're having a very different conversation than somebody who's trans or non-binary and has, you know, great insurance and has a different healthcare journey. So really, I think all of us would do well to plan now for the futures we want and to be, I'm telling people to be self-centered, right? Like this is the put your oxygen on first. Please don't be running around trying to take care of everybody if you don't have your primary care that you trust, who's an advocate for you. If you don't have the resources you need to be well, like we gotta take care of ourselves to get through these moments. So there's plenty of questions you can ask, and there's a lot of places to go depending on your age, your health condition. I think it's really dependent on those things.
Yeah, definitely.
But some basic things are, have you worked with this doctor before? Has anybody you know worked with this doctor or this medical practice before? And then craft your list of what's important to you. Do you need to know how many surgeries they do in a year? Do you need to know the types of insurance they take? Do you need to know what happens with your data behind the scenes? What system they're a part of? What are they collecting and what do they have to do with it? Federally qualified healthcare centers are in a different position than a private doctor, right? Right now, I am switching over to a mid-range concierge doctor. If you haven't heard of concierge doctors, they used to be thousands of dollars a month, just totally unreasonably priced. But there are more and more doctors getting out of these systems to say, hey, I don't want to see 30 patients a day. I want to see the patients that are mine and that I really know and that I can be responsive with. And so I just made that switch because I was like, I used to work with this group. I trust them. Even though I don't live in the same city, I will travel to get there so that I have good, trusted healthcare, and they don't have to give the government anything because they're self-funded. So, you know, really educate yourselves, keep acting like a consumer, act like our lives depend on it because they do, and ask whatever questions you have on your mind. And always have somebody with you. That's the best advice I would ever give, is have somebody with you in appointments, have your friends talk through your healthcare journey. There's a couple of places as queer family that I've really, with my own queer family, tried to break through the last number of years as we're middle age. Healthcare, finances, and spirituality. Because those are often places that are kind of ignored in friendship, but they're the real stuff of life. They're the real things that make your life better, worse, or vulnerable. And so open up conversations around healthcare and what you've experienced with your friends so that you can really advocate for each other as the time continues to come.
That's beautiful. Thank you. Yeah. Pidgeon, do you have anything to add to that?
Yeah. I love you so much. I love the work that you do, and I just love that I'm growing in a community that has the care plan at my disposal. So thank you for what you've built over the past 10 years and what you're continuing to build. And I hope to do something similar with what I've just started, which is called I'm still learning the name, remembering it. It's the Intersex Care, you're the Care Project. It's the Intersex Healing Club. And anyways, I just want to say I love you. And I used to work for this nonprofit called Interact, which is the only intersex nonprofit that's doing like legal advocacy and all types of work for intersex people. And I have something on my phone that's very top secret and special and coming out very soon. But they said I could tell you a little bit about it and answers this question perfectly. And if you guys have, I think I have a slide with a QR code, but if that goes up at any point, or if you just go to my website, sign up for my newsletter because I'll send you out this toolkit in a few days when it comes out. But it's a patient self-advocacy toolkit created by Interact specifically for intersex patients, but honestly, anyone can use it, especially anyone LGBTQ. And it has beautiful things like, first of all, use accurate and affirming language for bodies and identities, check. Ask about my needs, it's telling the provider, ask about my needs and goals instead of assuming, okay, check. Be transparent and inclusive in communication. And this is huge for intersex and trans people and everyone, get and confirm ongoing consent at each step. And be proactive in learning more about intersex traits and bodies. Now that's just the basic stuff. Now it has a part where you as the patient can fill this out. And I think this is huge that somebody told me a while ago, and I still to this day haven't done it. But we have also the ability as consumers to be, I guess, more empowered consumers, fill out a piece of paper so you don't have to answer the same questions a million times. Put all your medications, all your supplements, all your surgeries, everything that you want that your doctors always ask, you can have that on a sheet of paper and hand it out. And specifically for intersex people, there's these things that say like, my focus for today's visit is, I'm currently experiencing the following symptoms, and then there's check boxes. Then it says, I am okay or not okay with learners, such as medical students, being involved with my care. That's a huge one. That's a huge one. Really check in with your people about that, especially for intersex people. Then it says, if a sensitive exam is recommended, such as a genital, pelvic, or rectal exam, my needs include. Examples may be using the smallest speculum, having another person present, as we were just talking about, etc. And then there's lines to fill in. This is huge. Like if I had this when I went into that surgery appointment, that would have been so huge and empowering, but it just sometimes things go so fast and you lose your power, as you were saying. And I think it's so easy to sit here and say, just go be stronger, go be empowered, And look at me. I don't know if you guys know my history, but part of my history is going up against Lurie Children's Hospital for years and challenging them on the streets and getting them to become the first hospital to end intersex surgeries. And shortly after, Boston Children's followed suit. Now I'm seen as this strong person, this advocate for my community. The second I'm in that encounter in the medical physical exam room, I often lose all of my power. I often defer to the expertise. I often shrivel and get quiet and I stutter and I get scared and I just do whatever they say. So I think having this type of toolkit, there's so much more in here. Like, are there any other ways to make today's visit feel safe and comfortable for you? It goes on to talk about their anatomy and their past of medical history with surgeries and stuff. Having things like toolkits, just to have that in your pocket with your friend on hand. And by the way, I have this idea for a nonprofit that someone should start. It's called like Phone a Friend or something, where if I can't physically be with Jackie at the appointment, there's a nonprofit where we can go on the app and we can virtually be present with people that need a support system in that moment. And I think it's often good to have that peer support, just to have that peer support, but also to have someone taking notes. Because often I think I'm going to take notes and then I forget and so there's so many good reasons to bring someone with you. And it's just so good to have this toolkit. And like I was saying, it's from Interact. They've worked with folks at Fenway Health, I think, and other places on this toolkit. And I think it's an excellent, excellent resource. And if you go to my website, which is not there.
We will figure that one out.
Yeah, you can get on my mail list and my email list, and I'll send it out to you guys within a week or two. It's an amazing toolkit that's just going to come out for Intersex Awareness Day this year on the 26th.
Yay, that's exciting.
Come on, y'all. Come on, y'all.
Thank you, Jess. We have a couple more minutes. I have a couple questions here on our Slido chat. One of them being following is with that checklist is, what advice can you give someone who's looking to advocate for themselves in the medical space? I think that having that checklist or having everything written down is a super awesome idea. Do you have anything else, or do you know of any resources right off the bat that could be an additional supplement to that?
Mm-hmm. Yeah, I mean, really, practice makes perfect. And I think sometimes we're so nervous in healthcare settings because it feels like we don't have power, we don't know the rules, and oftentimes we're there for hard reasons, right? We've been in a hospital and somebody passed away or dealt with a long illness. When we go to the doctor, we're scared of what we know. So truly, I really encourage you to start wherever you're at and practice. This all changed for me when I was walking into a senior building and I saw the classiest lady walking out. She was probably 85. And I said, well, where are you going? You look amazing. She's like, I'm going to interview a doctor. I don't know if I'll choose them or not, but we shall see. And I was like, what is the last part she said? She said, I don't know if I'll choose them or not, but we shall see. Yes. And I was like, this is the attitude I've been waiting for my whole life. Like, yes, absolutely, absolutely. And so I really encourage you to just change your perspective a bit. See what your future in healthcare could look like. Let it be a place you're dreaming and figuring out, because anything's possible. There's so many providers that really care. There's so many providers that are also hurt by the system. And so I think, yes, write it down. And the first step is like, get real with yourself about what you need and want. Write out what you expect in a doctor. Write out what you're concerned about with your conditions or your health. And then take people with you 100% of the time if you can. And really practice asserting yourself, right? A lot of us, how many people have ever been a caregiver or an advocate, or you had to take care of your kids and advocate for them at school? Every single one of us. We have our advocacy voice. I break it down into 3 voices. The first voice is the kindest, the assumption that you're going to help and you want to help me. The second advocacy voice is more firm. It is, these are my expectations. Let's problem solve this together. And the third voice is pulling no punches, right? I will absolutely contact the administrator of this facility unless you listen to me or unless you give me a different provider. What you've said here and done here is not satisfactory. In fact, it's harmful. And that's not okay for me or anybody else, right? Advocate for yourself like you advocate for everybody else in your life is where I would start.
Yeah.
Keep practicing. It feels good to stand in your power in that situation.
Yeah, I have a couple more questions, if that's all right. What advice would you give to medical professionals who aren't directly involved with patient care, but still want to find ways to spread kindness throughout our healthcare systems?
Can you say that one more time?
Yes. What advice would you give medical professionals who aren't directly involved with patient care, but still want to find ways to spread kindness through the healthcare system? Did that sound a little more clear?
I have another idea for a nonprofit. It's I don't know if it's a nonprofit, but when I was in graduate school, I was really obsessed with this idea. I learned about this term called front of house and back of house, kind of like restaurants have, but I guess medical environments have it too. So there's the front of house, I guess, is where we see the doctor and the counter. But then there's the back of house, like the doctor in the back doing the notes or doing the labs or whatever. I have this obsession or this idea that I think can change the world, which is in the back of the house, there should be people giving massages to our medical providers. There should be people giving them acupuncture. There should be those quiet rooms that like lower the stimulation.
A sensory room?
Low sensory room. There should be every motherfucking healing thing see, this is okay, we're not live, I can swear. There should be every motherfucking healing modality at the disposal of those motherfucking doctors. Because how dare we expect them to give us care when they're not even allowed to care for themselves? Whose idea was it to make a doctor have 24-hour shifts when they're in school? Whose idea was that? Want to talk about brain rot? Let's look at their brains after being residents. How are we expecting them to care? Speaking of care for us when we don't even care about them. Sure, they're getting a lot of money, but how can they do anything with that money? Because they're fried at the end of the day. So I have this idea that we need to figure out how do they take care of themselves in the back of the room or back room, whatever the heck it's called, so that they can take care of us better. And you know how you feel after a massage? You're like, I love you. I love the world, right? Imagine if our doctors came out of a massage and then they came and saw us. I feel like that could really shift and change a lot of stuff. I don't even know what the question was, but I just need to say I think that should happen. And it seemed like you guys all agree with me. So hit me up. We can start a new nonprofit.
Absolutely.
/for-profit.
Hey.
Let's make that money.
It would change everything if healthcare was oriented around healing.
If it was around,
it would change everything.
Wouldn't that be crazy?
It would change everything. Yep.
If healthcare was oriented around what?
Healing.
Crazy
Imagine.
idea. Crazy idea. No, but it's really messed up, the system. Like, we really need to rethink it from the root, like a radical approach to thinking about it from the roots up. Like, we need to really change the whole thing. It's wild.
Agreed. And I just want to encourage, like, if you are in healthcare and you're not a provider, you're so powerful in creating a better culture at your organization.
Yes.
Bring that kindness, say thank you. One of our values at the Care Plan is a culture of appreciation because the carers are so often ignored.
Yeah.
You know, I want them to know how appreciated they are. So speak up often. Be that sweetheart in the office. Be the sweetheart on the phone. If you're in finance and billing, you're still providing a service and the person on the other side is still stressed. That kindness goes a long way. So contribute to a healthy culture where you can, because goodness knows healthcare can be painful on the inside.
Okay, thank you. I still have so many questions, but I think we are running close to time. Let me see, where is one? What does this moment in queer healthcare history mean to you in the context of the struggles that have come before, such as the HIV crisis? And how can young people entering these fields honor that history and support older queer individuals?
Well, I am an eternal optimist, like a disciple of hope. And I am not intimidated by this moment because our people survived long before we had permission, long before we had rights, long before we had anybody coming for us, right? We know how to do this. We know, and we still have elders and folks who were the activists in the 60s, 70s, and 80s who demanded HIV care and treatments. We have all that wisdom. And so get connected to the elders. Like, I would say that if you're looking for hope, if you're looking for a way to feel powerful right now, sit at their knee and learn everything you can. Because those lessons are not new. They are how we have always survived. From the first act of violence against a homosexual man, 20 years from the founding of Jamestown. That's the first time somebody died on our soil who was gay, killed by the government. From that time till now, we haven't needed permission to survive, and we certainly don't need permission in this moment. So other things that I'm doing is collecting as much research as I can, because the places we've gone, like the CDC, are removing us from their data and their databases. So I'm collecting as much research as I can so that I have reliable information. I would strongly recommend advocating in your community, right? I think it's really going to be interesting over the next couple of years how states are going to kind of replace some of the federal systems. Like, as we see out west, they're kind of creating their own, health center, CDC. Stay alert, pay attention, listen to the wisdom of the elders. Don't be afraid to innovate, right? We both are people that have started organizations to help our people live better. You can be that next person. Don't be intimidated. Don't let anybody tell you no. If you have a vision or if you want to fill some of these gaps, get out there, talk to us, and don't let anybody stop you. So that's what I would say. Done preaching.
Oh my goodness. No, I think I could listen to you forever. In case we do run out of time at this fire chat, feel free to, I'm sure that you folks would love to talk even after in case your question didn't get answered. I have one more question. that we're going to cover in this. It is, what do you recommend healthcare providers and especially healthcare students who look for deeper and authentic education about less commonly seen populations, such as intersex and queer geriatric patients, when the education being provided to them is grossly insufficient or inadequate? So,
I don't know if it's okay. I just want to say, aren't we lucky to have Jackie in the world? Like, I'm so lucky I live in Chicago with her. Like, that's the Chicago spirit. And I was going to say the same thing. Like, I don't care about this moment. Like, if we've had people come through slavery, we've had people come through the civil rights movement. We have people in Gaza who are refusing to disappear. There are so many people and examples in history that we have before us that are like, that would look at us today and be like, girl, are you kidding me? Like, you got this, come on. So I agree 100, 1,000, 10%. And yes, like, start, if you see a gap somewhere or a big hole somewhere, start something like the care plan, or start something that I just literally started like 2 weeks ago called the Intersex Healing Club. And the whole vision and the whole idea is just create healing spaces that are free for intersex people to come and heal together. So our first one is with my friend. We're doing sound healing and stretching. It's free. That's it. There's no board. It's simple, easy, and you can do that too. And I just wanted to underscore what you said. And then for the question, if you join my newsletter, oh, there's my QR code, pid.ge/newsletter, or click the QR code. I will send you another link, or there's resources on my website. Go to Interact's website. They have a whole resource section for providers to answer that exact question you had when it comes specifically to intersex people. That is where the locus, the nexus of all the intersex information is when it comes to that question. It's on Interact's website. You can get it on my website and the resources as well.
Yeah, and there's so many places to get information about us, right? As providers, every provider has to get some education on diversity and ethics for their license. So it might be that your healthcare institution has programming that you just haven't seen or taken advantage of. There's plenty of programs online. You can always reach out to the care plan. We do a lot of training around LGBTQ plus health and aging. And you know, there's plenty of organizations to go to, but a lot of it depends on your discipline, right? What a physical therapist needs is different than what a therapist needs, is different than what a surgeon needs.